Migraines. Migraines are another common type of headache. They affect 3 times more women than men. Migraines typically cause pain that is moderate to severe. Pulsate. Cause nausea, vomiting, or increased sensitivity to light or sound. Affect only one side of your head, but can affect both sides. Worsen with activity such as climbing steps. Last from 4 to 72 hours without treatment. Treatment. Migraine treatment is aimed at relieving symptoms and preventing additional attacks. If you know what triggers your migraines, avoiding those triggers and learning how to manage them can help prevent migraines or lessen the pain. Treatment might include rest in a quiet, dark room. Hot or cold compresses to your head or neck. Massage and small amounts of caffeine. Over-the-counter medications such as ibuprofen, Advil, Motrin IB, others, acetaminophen, Tylenol, others, and aspirin. Prescription medications including triptans, such as sumatriptan, Imitrex, and zolmitriptan, Zomig. Preventive medications such as metoprolol, Lopressor, propranolol, Inipran, Inderal, others, amitriptyline, Divalproex, Depakote, topiramate, Qdexy XR, Trokendi XR, Topamax, or Arenyumab AOE, Aimovig. Recognize emergency symptoms. Seek emergency care if you have a very severe, sudden headache. Headache after a head injury or fall. Fever, stiff neck, rash, confusion, seizure, double vision, weakness, numbness, or difficulty speaking. Pain that worsens despite treatment. These symptoms suggest a more serious condition, so it's important to get a prompt diagnosis and treatment. Take control. Almost everyone gets headaches, and many are nothing to worry about. But if headaches are disrupting your activities, work or personal life, it's time to see your doctor. Headaches can't always be prevented, but your doctor can help you manage the symptoms.